small businesses, self-employed freelancers, entrepreneurs, as well as rural and older Americans. Healthcare is a critical component in our society. Our healthcare system cannot afford this type of negative hit. Healthcare across the board will lose billions of dollars due to the uninsured patient care. From hospitals to physician offices, even prescription drugs. It is projected that here in New York State, 80,000 New Yorkers could lose their health coverage entirely. This will put themselves and their families at great risk physically as well as financially by being uninsured and not able to afford the increase in their health insurance. But I am glad to be joined this morning to help deliver this message and the impacts it will have on the community by representing the 2nd District of the Erie County Legislator, St. Jean Tard, 1199 SEIU Vice President Grace Bartholomew, Joe Guzma of the International Union of Painters and Allied Trades, as well as board member of Coalition for the Economic Justice, and board president of Voice Buffalo, Jimmy Darby.
Good morning, everyone. So, obviously, I am tired of hearing about healthcare being threatened. Because healthcare, it should be a right, it's not a luxury. I'm going to tell you a story about my own family. I have 2 working class family members, my dad, my mom, and my brother who had bad asthma, like really bad asthma. And just to get his prescription, his inhaler, it used to cost my family $200 a pop. That is everyday struggles for our working families. And now you want to make it worse? So then you're having them choose between paying their mortgage or their rent to cover their basic needs for their children, from insulin to asthma pumps. Is ridiculous. So I have a clear message to DC. Keep your hands off our healthcare. Keep your hands off our healthcare because we cannot afford this type of hit. I represent the county. We deal with a lot of services. And one of the things I'm noticing as a county legislator is that our lines are getting longer. People are struggling every day to just have their basic needs. And now we're gonna go after their health care? It's disgusting, and I'm not gonna stand for it, and I'm proud to be right here, standing with this group, fighting back.
Thank you.
Hey everybody, my name is Grace Bogdanov. I'm Area Vice President for 1199 SEIU's Western New York Nursing Home Division. We are here today less than 48 hours away from a government shutdown, a shutdown that, to be clear, can and must be avoided by the Republicans in Washington, a shutdown that threatens federal jobs, the American economy, and healthcare coverage and accessibility for millions of Americans. For New Yorkers, access to healthcare is already severely threatened. The cuts in Trump's big ugly bill are already going to cause approximately 450,000 low-income New Yorkers to lose essential plan coverage, well over 1 million people, and when I say people, I'm talking about mothers and children, seniors, those rural community members in Western New York who could lose access to Medicaid. Moreover, hospitals and nursing homes stand to lose billions in funding, threatening jobs and critical services in our communities. And now enhanced premium tax credits are on the line. These healthcare tax credits have been critical to the health of low-income and working New Yorkers, keeping healthcare more affordable as the cost of living continues to increase. The tax credits have increased ACA coverage for previously uninsured people, keeping their families safe and bringing down costs of uncompensated care for our healthcare institutions. And without immediate action to protect and enhance and extend these tax credits, over 20 million Americans, including, like Asim had said, over 200,000 New Yorkers, will be forced to pay thousands more for healthcare coverage or stand to lose it entirely. Our hospitals will face a surge of uninsured patients. They'll be forced to take on new, huge costs to treat them. And without funds to provide necessary treatment, services will be impacted for all Americans. And faced with these increased costs, our already underfunded hospitals will undoubtedly close. We've already seen the impact of underfunding in our healthcare institutions right here in Western New York. The Weinberg campus last year, Westfield's nursing home just this month, and Kaleida Health's recent service line closures are just the first signs of the devastation that the big ugly bill and the expiration of these tax credits will cause. Now is the time to give hardworking families a break. We can't afford to pay thousands more each year on health care. We can't afford any more hurt in our communities. So the message is simple. Republicans can make the choice to shut down our government, treat federal workers and American people like pawns. They can choose partisan politics over the interests of their constituents, or they can pass a budget that serves the American people. They can roll up their sleeves, they can keep our government open, and ensure that affordable quality health plans are within reach for all Americans. So I'm calling on all of you today to call your Congress member and demand that they represent the American people, not the interests of the 1%, that they keep healthcare affordable for New Yorkers, and that they extend the ACA tax credits today. Thank you.
That's right.
Good morning. My name is Joe Guzza. I am a board member of Coalition for Economic Justice here in Buffalo, and I'm Director of Political Action at the International Union of Painters and Allied Trades, District Council 4. Both of these organizations exist to fight for working people's rights. IUPAT DC 4 represents workers in 33 counties in western central New York. And I'm here today because the Republican Congress in Washington seems willing to shut down the government to make it harder for working people to avoid health care. This year, without congressional action, health care tax credits will expire. And what will the results be? Nearly 5 million people may lose their health insurance. Health insurance premiums for all Americans will rise even higher, with some estimating premium increases of up to 75%. And who will be hurt? Working people, working families, low and middle income families, seniors, children, small business owners, rural hospitals, and farmers. Nearly 30% of farmers are set to purchase their health care on the marketplace. Their premiums will go up, some of them won't be able to afford it, and it'll increase the uninsured in rural areas in western New York and across the country. We already know that looming cuts to Medicaid may put as many as 29 hospitals in rural New York at risk of closure. Elimination of the health care tax credits will only increase that risk. Look, MAGA Republicans control the House, the Senate, and the White House. In exercising their power, they show us on a daily basis that they don't give a damn about people who work for a living. There are representatives that remain willing to put together a federal budget that helps working people and low-income families by keeping the health care tax credits in place. The MAGA Republicans could avoid a government shutdown by working with them. But what's their response been? Screwing working people is more important than keeping the government running. In fact, shutting down the government might help them screw over more working people, namely the ones that keep the government working. So we demand that the Republican Congress stop screwing working people and extend the ACA healthcare tax credits. But failing that, we need to recognize and cry it from the rooftops that MAGA Republicans own this shutdown, and we will not forget it.
Good morning, my name is Tyrell Ford. I'm the Executive Director of Voice Buffalo. I come to you also as a parent. My children, they are marketplace users. I myself am a former marketplace user. If I didn't have the marketplace to go to when I couldn't afford health care, I wouldn't be able to afford my prescriptions. I have high blood pressure. Yes, I can control it now because I'm exercising and doing more, but without the assistance of health care, I wouldn't be able to bring my blood pressure down even more. As a community advocate, I believe that people deserve health care to live long, sustainable lives. If you take away the subsidy, folks will have to scramble on an already tax-burdened income to sustain themselves, sustain their lives. So we want folks to know that we're out here fighting for you to make sure that you continue to get health care, to get the benefits that you need. our senior citizens, our disabled community, they all rely on strong healthcare models. So like you're all going to chair right now, hands off our healthcare. Hands off our healthcare. Hands off our healthcare. Hands off our healthcare. We need you to act now. Call whoever you have to call, Senator Kennedy, Senator Chuck Schumer. We want to make sure they are fighting for the people. They always are fighting for the people, so we want to make sure they continue to do that. Thank you.
All right, as we conclude, I want to say thank you to our speakers for your passion and insight, and our message is clear. We want to stop these shutdowns, extend the ACA tax credits, fund our health care. Thank you.